So now that we understand what normal blood glucose is for, we want to get a sense of what happens when I have too much. So, as we had mentioned in the previous video, our brain, our body, especially during illness and stress, uses a lot of that blood glucose. But now, if we have a lot of excess, what's going to happen? So, coming back to our key players, our liver and our pancreas, our entire digestive tract are working consistently to send the correct signals to let the organs know when it's time to digest all of that blood sugar. But if that blood sugar starts to become excess because too much input is coming in and the pancreas is not able to keep up, eventually that blood sugar is going to stay in the blood. So ultimately, what happens is that blood sugar starts to travel to the tail ends of the body, the various ends where the smallest blood vessels are sitting. And because of its size, I want you to think about it as it gets lodged. It gets lodged at these ends of these blood vessels, and it really starts to break them down. Now, blood vessels are vital because that is how nutrients get to the whole body, and especially the nerves. The nerves are very much fed by these blood vessels, including all of your other organs. So, as you can see in this picture, many of these organs have tiny blood vessels. They're the end of the small, tiniest blood vessels, and those are going to be the ones that will get affected. So I'm hoping this makes sense that when you have all of that extra blood sugar, you start to see damage to the eye, you start to see damage in the brain, in the heart, the extremities. Even the digestive tract has tail end small blood vessels. A lot of the nerves get damaged, as I had mentioned, and the kidney. So, when you go to your doctor's office and they tell you that you have diabetes, the next thing they talk about is we need to start monitoring all of these organs and make sure that they're not getting excessively damaged by your blood sugar. You, as the patient, have a job to try to reduce that blood sugar. That's what the rest of these videos are for. But in that process, your provider is trying to help protect all of these organs that are actively getting irritated or damaged because of this. One very important thing to remember is the body is constantly changing, it's constantly adapting, and it's constantly growing. And so as you reverse your disease, the eyes will start to heal, the kidneys will start to heal, your nerves will start to heal. So I want you to think about it as a very positive thing that once you start making these changes, your body can heal. So it's not just reversing the blood sugar, but it's actually healing all of these organs. Ultimately, these are a list or a small list of things that your provider may be doing in terms of checks while you're in the process of reversing your disease. Checking the feet on a consistent basis for things like ulcers and the nerve sensation, checking the kidney to make sure that it's not spilling too much protein or spilling too much sugar that can cause a lot of damage, checking the eyes usually at least once a year is very common. Cardiac monitoring may be determined by your provider, and similarly, looking at your brain and its function. So, what I was hoping in this video to express is the importance of the monitoring piece as well. Healing takes time. You have to be the one to start it, but once you start it, these are all the things that a provider can help you do while you're in the process of healing to try to make sure that your body stays functional. I will see you in the next video as we now get started with understanding how to reverse our disease.